of air pollution, the simple act of breathing contributes to 7 million deaths a year.
Because of this pollution level, like it leads to many symptoms. Like I have a headache every day. I wake up and then like it's suffocating to breathe also.
I'm a patient of asthma as well, apart from diabetes, and I find it so difficult to breathe living in Delhi. Sometimes I feel that I should leave the city.
I don't know where the solution will come for this pollution, which is killing. We have become a chamber, gas chamber, toxic. I don't know where the solution and when the solution will come.
This is public health emergency. We are at crisis levels. We have no time to lose.
Air is important for the survival of all beings. We can survive days without food and water. However, without air, we cannot survive for more than a few minutes. The quality of life we live depends a lot on the quality of the air we breathe in. However, access to clean air has become a global issue, as air pollution is now considered to be one of the largest threats to environmental and human health. The World Health Organization estimates that globally around 7 million people die every year from indoor and outdoor air pollution. Almost 92% of the world's population breathes air containing high levels of pollutants that exceed the WHO guidelines.
We've already seen in Delhi, it has become the most polluted city on earth. And this is due to the huge population which is here. The amount of vehicles that we use are the maximum. This is causing a huge amount of pollution in the air.
Access to clean air is a global challenge because of the factor that rapid industrialization, urbanization, our lifestyle changes and environmental degradation, these all are adding to the deterioration of air quality. So globally this is happening, that the United Nations has now asked, Secretary General has asked to declare air pollution as a global public health emergency.
A rapid increase in the human population, industrialization, deforestation, economic growth and vehicular transmissions have been attributed as major drivers for the continuous deterioration of air quality.
The amount of energy per person that we use is very high, and therefore the amount of energy that we use causes an immense amount of air pollution, which is mainly coal dust, which causes the air pollution. This is leading to a lot of diseases, asthma, etc. And therefore the growing population is the main factor why our cities are getting polluted.
Air pollution, as we all know, is a global concern nowadays, and as per the WHO, which has estimated that 9 out of 10 people are breathing this polluted air. So it's a big concern for everyone globally. Air pollution is mainly affecting the developing countries at present. Definitely to the developed as well, but to a greater extent for developing countries. Why so? Because they are moving more towards the urbanization, the uncontrolled urbanization, industrialization, which is leading to more build-up of industries. So the emissions from the industries, the construction work which is going on, so the amount of particulate matter which is being produced into the atmosphere is a huge. And the other factor is the developing countries, the cities are being overpopulated. So the overpopulation, so therefore definitely the consumption is more, the setups, the deforestation amount is more, so there are less trees. All these factors contribute to the air pollution.
Increased industrialization leads to environmental degradation in terms of industrial pollution. High emission levels of pollutants like smoke, fumes, and toxic gases from industries not only degrade the air quality, but are also causing severe damage to our ecology and health.
The most highly polluting factor for causing air pollution is power plants. So how do we get rid of the pollution from the power plants? The first thing we do is clean up the emissions from the power plants. You can put in machinery for the air so that the emissions which are coming out goes through precipitation process, and the final air which comes out is pollution free. The second thing that can be done for the power plants is to phase out the burning of coal. We have to do all electricity generation from renewable energy, and that has to be done instead of using coal. Coal has to be phased out altogether.
One of the reasons why we are not being able to control the rising level of pollution, just not in Delhi and NCR, but across the country, primarily because we are growing economically now. India is industrializing, motorizing, and with the more and more households using energy and the use of the kind of fuels that we are using in different sectors, all of that are contributing hugely to the pollution that is happening across the region.
Like slum area, there are very small industries there. So like electroplating and other things. So they are releasing some kind of hazard gases also, like acid and all. So that should be controlled. That it should be moved from the city. And they should have some kind of common treatment plant, common air pollution treatment, or maybe individual, but this should be controlled.
Considering a large number of vehicles available at our disposal today, vehicular pollution is one of the major causes of air pollution across the globe. Due to an increase in urbanization and a rise in purchasing power, more people can afford vehicles, which leads to a surge in vehicular emissions that deteriorate air quality.
It took about 60 years for India to get its first 100 million vehicles. But after that, it took just about another 6 to 8 years to get another 100 million. Now, therefore, imagine if the growth happens at that scale, then, and if we do not have efficient way of controlling emissions from each and every source, if our regulations are not strong enough, then that's the deadly combination.
The effects of air pollution on human health are serious. Diseases like asthma, lung cancer, pulmonary issues, and heart diseases can all be associated with air pollution and the poor air quality we inhale.
When we relate our air pollution and our health, we have some kind of benchmarking, like we have air pollution level at certain level, that dust concentration is at X amount, some gases pollutant at Y amount, there is no impact on health. If this the air pollution are increasing at certain level, they will have some kind of health damage of human body. So that increment we have to focus that it should not be increased at that level.
Pollutant is basically an irritant, so it can cause irritation in your eyes. The patients can come with you complaining of a irritation in the throat, constant production of cough in the throat, so they have to clear that throat again and again. Patients who are already a respiratory patient, like patients who have a asthma or COPD, they can have increase in the underlying illness. So they can come with the exacerbation of the disease, which might require increase in the medication or hospitalization of the patients. Patients are prone for cancers, the lung cancer. Earlier when we used to see patients, we used to see lung cancer in older individuals and smokers. But now we see lung cancer more commonly in non-smokers, younger individuals. We are seeing patients with lung cancer at the age of 20s, 30s.
As per the World Health Organization, 9 out of 10 people in the world, they are exposed to bad air quality. And the burden of disease because of air pollution is tremendous. It causes almost $8 trillion loss to GDP globally, which amounts to around 6% of global GDP. which is huge.
The most vulnerable to the adverse effects of air pollution are children, as their lungs are growing, and because children are active, they breathe in a great amount of air. Several studies suggest that polluted air can harm babies when they are in the womb.
When a child is born, the lung development, 80% of the lung development happens after the birth. So you just imagine a child whose lungs are not well developed and you are exposing that child to the air pollution. So the pollutants, these pollutants are entering his or her airways, causing so much of oxidative stress and inflammation. So definitely it is going to retard the development of the underlying lungs.
Exposure to air pollutants during the early months of pregnancy can severely impact birth outcomes, as children can be born with defects in the respiratory system and defects of the brain and spine.
Some of the recent studies, especially those coming from the WHO, showing that the number of children below age of 5, the maximum number of those children are actually dying in India because of air pollution related diseases. And there is yet another study which has been carried out by doctors from the Patel Chest Institute. They show that children who are growing up in polluted environment like Delhi, they are growing up with smaller lungs. Now compared to the children who are growing up in healthy environment, just understand the implication of that. If a child has a smaller lung today, what it means when the child grows up as an adult and how vulnerable then they become to host of other diseases.
They can develop acute or chronic lung diseases early in the age. Even if they don't have a predisposition to develop an asthma, they might develop asthma. When a pregnant woman, when the fetus is developing in the womb of a pregnant lady, that too has an ill effects. It can lead to growth retardation of the underlying fetus. The studies have shown it has been leading to preterm deliveries. The deliveries are happening earlier than the normal date.
According to a report by the WHO in 2016, almost 6 lakh children died globally because of acute lower respiratory infections caused by air pollution. A recent study by WHO reveals that around 93% of children worldwide under the age of 15 breathe in air that is so toxic that it severely impacts their health. India is home to almost 1.39 billion people and is set to overtake China as the most populous country by 2027. The impact of the country's growing population on air quality is clear. India is ranked 3rd on the global index when it comes to worst air quality. The World Air Report 2020 reveals that India caters to 22 out of the world's 30 most polluted cities, with New Delhi being ranked as the world's most polluted capital. Covered with smog, New Delhi has been facing continuous challenges to curb air pollution. The latest statistics from the Central Pollution Control Board indicate that the particulate matter 10 and particulate matter 2.5 levels crossed 400 micrograms per cubic meters in the first week of January 2022.
When we say winter condition, it means cool and calm weather conditions. There is an inversion, air gets trapped very close to the ground level, and with that, all the pollution that is happening in the city also gets trapped. Every winter we see this visible smog. But this only reminds us that such a buildup is possible if overall pollution in the city is already bad.
Emissions from vehicles, industries and power plants, dust from heavy construction, waste burning and seasonal activities like stubble burning during harvest season and Diwali fireworks are the major drivers of the poor air quality in the national capital region.
There have been apportionment studies about what kind of causes, particularly the transportation causes almost 40%, 39 to 40% of pollution. Industry 22. The domestic causes, they are close to 5 to 6%. 11% of other causes, that includes stubble burning and other causes.
The ongoing COVID-19 pandemic in the country just adds to the ill effects of polluted air. A report from the Harvard T.H. Chan School of Public Health in 2020 suggests that people living in highly polluted cities are more vulnerable to respiratory and heart diseases and hence are more prone to develop COVID-19 symptoms.
Definitely, if people are living in polluted areas, they have definitely increased risk of getting infections. Why so? Because the pollutants have already caused an injury in your airways and your lungs. They are already inflamed, there is more oxidative stress. So the infection when they acquire, definitely the severity of infection could be much more higher in a people living in polluted areas where their lungs are already affected.
In November, the air quality index of Delhi remained in a severe category. As per the System of Air Quality and Weather Forecasting and Research, stubble burning contributed 36% to the city's air pollution this year. Experts from NASA suggests that the stubble burning on November 11th could have affected around 22 million people on that day alone. Increased migration of people in Delhi is just adding up to the already rising population of the city, which directly leads to more construction, industries, energy production, and vehicular emissions.
Over 100 cities in India has been considered as non-attainment city by Government of India's standards. Concentration of population in larger areas, particularly metro towns, is becoming a major source of air pollution, both in terms of transportation problems, the dust pollution, industrial units which are being located close to cities, and adjoining rural areas also they are having ancillary industries like brick kilns, which are major source of pollution.
As the capital remained covered with a toxic haze after Diwali, firm measures were taken by the authorities to combat the situation. All schools and colleges were shut down indefinitely. Construction works were suspended till the 21st of November, and only 5 out of the 11 coal-based power plants in the city were authorized to function. However, considering the alarming levels of PM2.5 and PM10, clearly these measures are failing to tackle the crisis.
Delhi has already shut down all coal power plants. Delhi does not allow use of coal in any sector. Its legal industry has moved to natural gas. Its entire public transport and local commercial transport is on CNG. Delhi is now banning 10-year-old diesel vehicles and 15-year-old petrol vehicles. There is a restriction on entry of trucks, and already BS6 emission standards have been implemented for new vehicles. Now, these are not small measures actually. No other city has actually done all of this that Delhi has done. Even after doing all of that, Delhi is still far off from the clean air benchmark. It still requires another 60% cut to be able to meet the clean air benchmark.
In August 2021, India's first ever smog tower was installed at Connaught Place in Delhi, aiming to purify the polluted air of the city. A month later, in September, a second smog tower was installed in the Anand Vihar area of the city.
Delhi is battling for many years to combat air pollution in Delhi, and this occurrence of smoke is very common every year, and it's due to particulate matter. So we are very much concerned to contain this particulate matter.
Both towers stand at a height of 24 meters and are equipped with 5,000 high-efficiency particulate filters and are designed to process 1,000 cubic meters of air per second.
Objective was to create special zones where people can breathe there. So it is a kind of generation of clean air breathing zone.
This application of smog towers is still in its early stages, and only time can tell how effective these towers are. Finding solutions to fight air pollution has been an ongoing challenge for the country. Thankfully, there are many entrepreneurs and volunteers who are developing new technologies to fight the crisis. Meet Barun Agarwal, CEO at Breathe Easy Consultants in Delhi, who has been working with his team in developing new technologies to test and purify indoor air.
I believe that consumption is the bane of our society today, and as our population increases, so does consumption. We had the luxury of having a building like this, Paharpur Business Center. It was certified to be Delhi's healthiest building by the Central Pollution Control Board. The air quality over here was perfect. We had access to Lawrence Berkeley National Labs, scientists over there, to IIT Delhi, to NASA, and all the research findings from these places is what we had worked on to create a haven of clean air over here. So I took the science from what we had developed over here and we created Breathe Easy to help people breathe clean air. First in Delhi and now in the rest of India and now even in countries outside of India. When we put in a solution, we are able to bring the AQI inside a home down to 0. Lower CO2 levels, as you can see in a room like this in a greenhouse. Why do we have so many plants? We have so many plants because these help reduce the carbon dioxide levels over here. Low CO2 means better cognitive ability. Better cognitive ability means better decision-making ability. And we've done studies over here that show that your SpO2 levels might go up by 1 or 2% when you're breathing very low CO2 levels, along with low PM2.5 levels.
Today, Breathe Easy consultants offer the best portable air purifying techniques and comprehensive solutions to treat and purify indoor air.
Our goal and our vision going forward is simple, that 100,000 or so people that we have impacted needs to become much larger. I want to impact 100 million people, and the only way to scale that is A, awareness, and B, bringing the cost down. And I think with technology we'll start to see that in the next few months and years.
Air pollution and declining air quality are global issues. Though all regions of the world are affected, populations in low-income cities are the most impacted. It is in large, populous cities where we typically experience the worst air quality. Population density has a direct bearing on air pollution. All of us know that the most basic solution for air pollution is to move away from fossil fuels, replacing them with alternative energies like solar and wind. The latest global air quality guidelines from the WHO aim to curb the prevailing air pollution globally and in turn save millions of lives.
These new guidelines will have major implications for public health. They provide a practical tool for improving air quality around the world and a robust evidence base for developing national and local air quality standards. They can also help to inform and strengthen policies in sectors including energy, waste management, agriculture, and transport.
But it is equally important to reduce our consumption of energy. This can be done by adopting more responsible habits, including adopting sustainable agriculture measures to prevent stubble burning and stabilizing the human population. Air pollution is a silent killer, but it can be curbed with a strong commitment and effective planning.